Hello there, this is Esther James again from NTR TV. For our special viewers, we bring to you information from different segments all the way from Turkey. And for the past few weeks, we have a special hospital, one of the most recognized hospital in the heart city of Ankara, which is the capital city of Turkey. And we have so far interviewed from different departments of Koru Hospital. We talked about with some of the professors from the international sector that deal with the international patients, and also we had one of the professors from the heart centers. We also spoke with one of the professors, one of the special physicians from the urology clinic, and now we are so happy to bring to you from the Orthopedics and Traumatology here with us. So don't go anywhere, and in case you miss some of those ones, you can as well go back to our previous videos. Thank you so much, sir, for having you on NTR TV. It's a pleasure to meet with you, sir.
It's a pleasure for me also to be here with you.
Thank you so much, Professor. Could you please formally introduce yourself to our viewers and the department which you operate?
I am Professor Dr. Süleyman Bülent Bektaşer. I am Chief of Orthopedic Departments in Koru Hospital. We are an international hospital. We have a lot of international patients. So we have to organize in a wide section in orthopedics. Orthopedics is a wide medicine department. Mm-hmm. So we have 3 professors in our clinic. Mm-hmm. One is mine. The other one is an associate professor. Also 2 specialists on traumatology and orthopedics in our clinic. We have to do work with technology in our Koru hospital. Okay. So we have to use international new technologies, surgical apparatus. Yeah. We have to work on technology. Mm-hmm. So in our department we are so related to technology. Yeah. I must talk about mostly on technology because yes, our hand is in technology in orthopedics. Yes, sir. We are using arthroscopy techniques, mini-invasive techniques. Mm-hmm. We have 3D tomography for trauma and cancer patients. Mm-hmm. We are using widely ultrasound for soft tissue trauma. Mm-hmm. So we have a good MRI department. We have a very good radiology department. Mm-hmm. We are so related because we have to work with them. Yes. They help us to find clues for the patients. Mm-hmm. So in our clinic we have to use high demand on the technology. Yeah, from the previous professors, they also make mention of these technologies, which I think it makes this clinic or this hospital well recommended by so many international patients. Talking about the orthopedics and traumatology, how can you explain to us the technology used in this department? Yeah, especially in technology we are using radiologic views for taking clues, as I said you. First, I talk about MRI. You know MRI. Yes. We are using MRI for trauma, soft tissue cancers, and also sports trauma. MRI is very important for us. We are working on highly on sports, especially one of my specialists on sports. Mm-hmm. We have one orthopedic surgeon. He is working on vertebral column, spinal column. Mm-hmm. He is using 3D tomography and MRI together. It's also related to tomography. Mm-hmm. So in sports trauma, I told you, we are using mini-invasive operative techniques. So arthroscopy is one of them. Also in growing technologies, in arthroplasty, as you know, joints are degenerated in old people. Mm-hmm. So we have to change these joints on new joints, artificial joints. We say this arthroplasty or knee or hip prosthesis. In these technologies, we are using most important prosthesis, and with the growing technologies, we are using robotic technology.
Yeah.
Maybe in further talks we can talk
About that. It's amazing. I saw.
It's amazing.
And
also, technology
yes,
is
what
amazing.
technology.
We have to run with the technologies inside our clinic.
Yes, and it's so amazing that there's this trust, as the professor, the doctors trust this robotic, and they're actually doing the best of job that you expect them to do.
Yes, I told you, radiology is one our hand, the other hand is robotic and technological equipments.
Wow.
So we have to work together with them.
With them, yeah. So which diseases are you interested in the diagnosis and treatment of the orthopedics and traumatology in this clinic?
In our clinic, in our department, I told you, we are 3 professors, 1 associate, and 2 specialists. First, I have to talk about our clinic. In our clinic, mostly our international patients are coming for arthroplasty, degenerative joint diseases, maybe we can put in a question mark, and sports trauma, cancer, orthopedic oncology. Pediatric, we have 1 professor who is specialist on pediatric orthopedics. It's very special work. So we have a new colleagues, he's working with us, hopefully. It's very good for us. We are vertebral column surgeons are very familiar surgeons. We have 1 professor and 1 associate professor is working on spinal cord pathologies. We can say scoliosis, spinal cord trauma, cancer, or something like that. Generally, we are working on orthopedic trauma, fractures, ligament ruptures, sports trauma, and also orthopedic oncology is one of our main department. So we are working in orthopedic oncology. We have very good specialist oncologists. We are working with them in orthopedic oncology. So we can cover in orthopedic 99%. In orthopedic surgery, coverage is disease coverage. Yeah, in all diseases, I think 99-95 coverage. We have specialists working on these topics.
Oh, wonderful! From the history and also the record of this hospital, I've noticed that you treat lots of international patients in a very large, unbelievable number. So why do you think a lot of international patients prefer to come to this hospital, especially your sector?
As you know, in medicine, if you treat a patient in a good way, if she is or he is happy, so they will bring 10 patients.
Yes, exactly.
It means that our patients, international patients especially, very happy because we are working in high technologies. In their countries, they cannot reach in high therapy, in high level therapy or disease diagnosis or something like that. So I think we are near over the top in orthopedic surgery. So they found us. We have you talked about a lot of international hospitals, mostly from North Iraq, Iran, Azerbaijan, as I remember. In African countries, Somalia, Togo, Nigeria, lots of, as I remember, Libya, from Libyan patients.
They come
mostly,
as well.
Yes. Half of them, our patients are from Libya.
Libya, wow.
It's interesting.
Yeah.
Also, we don't say international. Turkish people working in European countries, they are coming to Turkey and they have surgeries in Turkey in our clinic.
Yeah, and then they go
also,
back.
Yes, we say international Turkish people.
Yeah.
Also, they are coming and Turkey back. And they have their diagnosis, therapies in here.
I think personal experience, I would say I have a few friends who came from Africa for a treatment, even also some that came to this hospital. Would you say, apart from the physicians, the services, maybe in terms of comfortability and trust, it contributes to why international patients prefer coming here?
As I said to you, if one patient is happy and Especially we can give an example in pediatric patient group.
Yeah.
A family is very anxious, their kids have some problems. If we go, we can do what we want. If she or he is walking and smiling to us and going to your family or his family,
Yeah.
it's most important thing that most of our patients are happy and coming back. New patients, more patients.
Yeah.
So one of the clue is that
Oh.
correct therapy, happy people, as the people they get what they want
Exactly.
in our clinic.
That's amazing.
Yeah.
So what is the place of Koru Hospital compared to orthopedic practices around the world? Having these qualities you have already said.
I honestly, I want to say that we are near the top. We cannot say we are on the top.
Yeah.
Because a lot of things we can do. We can learn. We can learn new technologies. We have to use new technologies. There is a race in technology in orthopedics.
Yeah.
We have to construct our technologies also more. So we can say in European countries, in Middle East, also as we see in Africa, we are near the top.
Yeah, the
as
top.
in orthopedic surgery. Honestly, we can say that like that.
Yes, they
Not
said
top, near the top.
near the
it's
top.
better to say that.
It's a great rate, I think. It's a very great rate. So can you talk about the multidisciplinary of your clinic with other clinics, such as physical therapy and rehabilitation?
Yeah. So as I said you before, in oncology, I told you we have to work with oncology doctors. But in orthopedics, generally we have to work with physical therapy doctors and physiotherapists because we do surgery, but they made the people to work to use their hands. So a physical therapy department is very important for us. We have a very specialized two physical therapy doctor. Also, we had in the over the top of our hospital very big physical therapy department. They have very experienced, especially international patient hospital relationships. Most of them know international languages.
Yeah.
They are using very good and technological equipments. So we do surgery, but the therapy is not only with surgery. We have to work with physical therapy doctors and physiotherapists. Or the other hand is physical therapy.
Yeah.
If physical therapy is good, our therapy is good. So
Yeah.
we combine with them. We have to work with them.
No, it brings this relationship between the patients and the
Yes,
doctors.
they have to go to contact with the patients and with very good contact with our departments. So we can go directly to solution for the patient. So
Yeah.
it is best for the patients.
Yeah. So can you talk about the robotic surgery application in the knee joint, because you mention a lot about the spinal cord, the joint, and then bringing together this enhanced technology, trusting it and giving the best of its service to human health. How do you think this robotic surgery goes about in the joints, the spinal cord you make mention?
So robotic technologies are future for orthopedics, as I said you. Before we are very experienced surgeons. We can do knee surgeries as we want. But in robotic technologies, the making mistake is very low. Robotic technology, in orthopedic robotic technology, urologic robotic technology is a little bit different than our technologies. We are using computerized tomography. As an example for the knee, it's also growing for hip surgery and also you told spinal surgeries. I can give an example for the knee. Before we are using with our experiences, we are anatomic knowledges, we are doing knee surgeries. But in robotic technology, we are using computerized tomography. We are taking the picture of the knee, 3-dimensional of the knee, and put in the things inside the computer. Computer is making a line for us. So making mistake is very, very low in robotic technology. if we go in wrong way,
Yeah.
the robotic technology stop us. So making mistake is very
It's
very
less.
low with robotic technologies. Also patient comfortness, rehabilitation, staying in hospital, also very less with robotic technologies. So we will use, I think, in the future in hip also. We are beginning to use in hip. So as the technology is beginning in the spinal surgery, I think it's the future. We will do.
Yeah, I think
we
it's
will
the
do.
future.
We will go on that.
I can see that, especially after the pandemic, which after the pandemic, a lot of things have changed in terms of the media, the hospital, general life, the human life has changed, and it's so amazing when we talk about the health. You see, the technology has taken, would I say has taken over, or it has enhanced the work of our physicians in terms of handling health. So in your own profession, what will be your advice to people? Because of course, even though we want to treat them, we would want people to still take care of some certain things to avoid the major diseases that affect this joint. Yeah.
As our clue in from this topic, for the patients, especially we are talking about arthroplasty, degenerative diseases first. Overweight is not good for us. So living a really good quality of life,
Yeah.
staying in walking in natural life, without heavyweight diseases, we have to avoid them. Sport activities. We don't want everybody is a sport player, but everybody must do recreational sports. Walking, swimming, exercise is life.
That
Life
keeps
is
the
exercise.
joints,
Yeah.
yes.
Jogging is walking, jogging, swimming. If your health is very good, you can do gym, you can go gym. Everybody can't be a sportsman, but
Yeah.
everybody can do some little exercises according to their health.
Yeah.
So exercise is life. Life is exercise.
Exercise. I love the
Both
fact that,
go to-
yeah, you
Quality
said
of life depends on exercise.
on exercise. Not
So-
everybody is an athlete, but at least
We don't
everybody
want,
can
we don't
take.
want, yeah, we don't wait.
Yeah. we
But
don't-
activity is very important
it's
for
very
us.
important.
Most important clue for our patients.
Yeah.
Activity, active life,
Yes.
always same. Activity, active
It's
life
always
is
the
important.
same. Yeah. You have treated a lot of patients. Which particular diseases from the joint or in your area of specialty you know that is on the high demand or it's highly occurrent in our body? Who are the most high diseases in
We
this
have to talk
field?
about age group. In younger age groups, pediatric coming from genetic diseases are mostly important. After young age, sport activities, sports trauma, fractures, traffic accidents are coming to us. In old group, as you told, degenerative joint diseases with the knee, hip, hands, and spinal cord. Degenerative diseases are coming in most problems for the people, according to age group.
According to age. So which age do you think we should be more sensitive? We must be more
We
careful.
must have to
in
be
that
sensitive
age.
on all the age group.
Old age group.
According to my professionality
Yeah.
also, we have to work on all the age group. So again, the same thing, activity and not to be overweight is more important for degenerative diseases.
Okay. Well, I hope that your hospital gets more patients because the patients need your services, I think, because of the infrastructure, the location, the physicians, the professors, they seem to be very, very highly qualified in Koru Hospital. So talking to our viewers from 42 African countries, we want to hear your last words to them.
Okay, as our clinic, we are working for you. Also, we are going on very good high technologies. I hope no one will be ill,
Yeah,
but
hopefully.
if you have some problems, you can come to us. We are trying to help you. We are trying to have good therapies for you. I hope no one will have some diseases.
Oh, hopefully. We
Yeah.
pray for a good health.
Just pray for
We
that.
pray for a good health. Thank you very much for your time, sir, and hoping to have more information again from this sector, from Koru Hospital, and it's always a pleasure. Thank you.
Thank you.
Yeah. Hello, dear. We have come to the end of this segment from the Orthopedics and Traumatology, and we have Professor Dr. Bülent Bektaşer. I got it right?
Yes. Good. You are going good. Yeah.
Okay. He has told you the necessary information you need to know. Koru Hospital is on the top list of the best private hospitals, not just in Turkey, but also in the world. Personally, I can say they have a highly sophisticated, intensive, high technology in terms of treating your health. So do not hesitate to ask any information in terms of the process of visas. How do you contact this hospital to meet with the best of their doctors? That's why we are here. Please do not hesitate to contact information on your screen, and for more details, just ask. Whichever doctor you need to know information from this hospital, we will provide it for you. That's why NTR TV is here, to connect Turkey to the African continent. And keep watching NTR TV. See you again on the next segment. Thank you very much.